When I started this 14 years ago with President Clinton, he helped me launch it, as you all know, and he was wonderful. And at the end of it, I said to him, I said, President Clinton, what advice would you give an upstart summit like C3? And all of you know how he wags his finger like this. And he said, Ransel, 3 things. He said, do not try and be a tsunami. It will surge and subside. And I said, all right. And he said, don't try and be a wave. It will crest and crash. And I said, well, what should I be, President Clinton? He said, be a ripple. A ripple just keeps gently reaching out. And all of you are that ripple that I have been able to see reach out over 14 years. And I have to tell you, I've had some wonderful ripple moments. And I'm not talking about the wine. It was a time when we had Hemi Perez come and speak. And he is the son of the former deceased Shimon Peres. And he was giving his keynote, and he had said that one of his business models, and he has the largest private equity firm in the Middle East called Patango. And his partners back then, this may have changed, but this was back in 2014, one was Syrian and one was Palestinian. And one of their business models was that if you could show with a pro forma that would break even in 5 years that they thought was really something credible, they would consider funding it under 2 conditions. One, you had to be between 18 and 25, and then you had to be an Arab youth. Well, everybody got up, and you could have heard the applause. It was thundering, and here it was, Hemi Perez. Please kill the phone, whoever has it. And he really moved the audience. And an Arab diplomat, which I won't tell you who it was because he comes every year, he'll probably be here later, he came up to me and he said, Mr. Potter, he said, I thought this was U.S. Arab. And I said, well, it is. And he said, but you had Hemi Perez here. And I said, I did. And he said, but, and I said, but before you say anything else, I saw you standing at the end of the front row clapping harder than anybody. And he said, but that's what I wanted to tell you. I realized that we can live and work side by side. Well, that was a ripple that obviously I'm not sure it's carried forward today, but it was one of those moments where I realized that really you can make a difference. And I think that's really what it's about, is doing something where you're not just taking up space. And none of you are. All of you are here because you're doing something. And I admire all of you for that. And I'd like all of you just to turn and shake hands with each other because you're the ripple. So if you would do that, I'll give you a big hand of applause and just give a quick handshake to everybody. That would be great. I would love that if you would do that, Now, I said a quick handshake. We have to keep going. But this is great. This is what it's about. This is the ripple. You all are creating the ripple. So I'm proud to say that we have over 20 countries that are represented here today. And that, to me, is, again, what this is about. It's bringing people together so that they can listen, they can learn. And I do call it healthcare diplomacy because I don't think there's anything more important than healthcare and taking care of one another. So what I'd like to do at this point, I'd like to call up one of our honored, distinguished speakers. And today it's going to be, I'd like to ask Dr. Bjorn Zoega to come to the podium, please. He is the CEO of King Faisal Specialist Hospital Research Center in Riyadh, the Kingdom of Saudi Arabia. And I'm honored that they are our title sponsor, which has been wonderful. And they've been with us for a number of years. And I think we've kind of grown up together, although I think Bjorn grew up faster than I did. I used to be his height, but after 6 children, I lost an inch with every one, I think. But anyway, Dr. Bjorn, there you are. So I'm going to turn it over to you, and we'll move forward from there. Thank you.
Thank you, Ransel. It's great to be here. I would say as usual, but this is only my second time. I just want to start off by saying a few things here. Friends, ladies and gentlemen, guests, colleagues, leaders in healthcare. Start off by saying good morning and welcome to this extraordinary gathering that we have of people who are just in the frontiers and want to be in the frontiers of global healthcare. My name is Bjorn Zoega, as you both seen and heard. I serve as the Chief Executive Officer of King Faisal Specialist Hospital and Research Center in Riyadh in Saudi Arabia, and been there for 1.5 years now. We at the King Faisal are as a strategic partner for this event. We are proud to stand along this society in advancing the difficult but needed conversations that will define the future of healthcare. So I think this summit is more than just gathering of experts and stakeholders. It's a forum where we have the science, the technology, and the leadership to move forward, to change and reform, reimagine how we do medicine. And we all know why we do that. Of course, it's our job as well, but we do this for the patients. We have a clear vision of why we're in it. It's to help the patients and be ready for the future. For decades, King Faisal has been a place for complex and high acuity care, not only in Saudi Arabia, but also across the Middle East. We're a tertiary and a quaternary hospital where we routinely deliver care that is on the most advanced levels of medicine. And we perform procedures that rank among the most challenging anywhere in the world, and some of them are pioneering. We have a great experience across many specialties. What King Faisal has is not only the breadth of expertise, but we as an academic center, we also have the usual integration of care, research, and education under one umbrella with our own control of it. Our outcomes benchmark against the best institutions worldwide, and in many cases exceed the international standards or outcomes. With collaborations, research publication, and training programs, we are going to the sharing our knowledge publicly. We want to be transparent, which we have not always been in that, and that we see as a major obstacle in delivering healthcare in the future. And I hope by attending this meeting, we sort of move the needle on the understanding that what is happening, both in Saudi Arabia and in the area, so that we are now part of an international society. At King Faisal, we are committed to expanding the possibilities of what is considering possible in healthcare. I've been working with this in different roles in different parts of the world. I think what we should say is we want to do what is considered impossible. Otherwise, we won't move the needle in any way for the patient. Our mission has to move the boundaries, like I said, and transfer them into solutions. It's not only just talk about we need to do something. And sometimes when I meet with my people, I steal from another big company that's called Nike, and I said, we just need to do it. I have a nice T-shirt that says, just do it. Some things we can talk about, other things we just need to do. So we are our hospital is really proud to have achieved many sort of global first and regional milestones. We were sort of one of the earliest adopters of pre-implantation genetic testing for families that have risk for genetic diseases. We have our top of the line with better results than the European counterparts for our pediatric transplantation programs. We are, I would say, one of the world leaders in advanced robotic surgeries, doing the world's first in many difficult cases, both in transplantation but also in other things. We did the world's first heart transplant about a year ago, and we're still doing world first in many ways. So we are sort of laser focused on that one because we've had great success. And it's not about money or anything like that. It's just about empowering the people that have this sort of knowledge or special knowledge to do things and move it forward. We're also building a GMP facility that we can, with the great support of I would say, more than the government. This is a personal gift from the leadership in the country to give us a budget and money for building our own GMP facility, which is big in challenging times that we have now, money-wise, and that is something that we are extremely proud of, and has already set the sort of pace for what we are doing. We have the technical capacity in many ways. We have the knowledge because, just so you know, that our consultants that work at the hospital, they're not inbreed. They don't get a job as a consultant with us if they haven't been abroad for at least 2 years. And they do that. They go to different programs in different parts of the world, so we gather what we consider is the best to the hospital, and we're going to do this even more. We have been a sort of a center for patients across the Gulf and the wider region, but we are more and more coming, like I said, open, international, and we have a clear mandate to do that. And we want to be part of, as much as possible, part of the medical society, the international one. So this has also been powered by what you might have heard as the Vision 2030, which is sort of from the highest leaders in the country, that has made us sort of empower people within the organization, but also given us a strategic direction where we want to go, and that's one of the things that I noticed coming from Iceland and Sweden to Saudi Arabia, is the ambition that comes with this, having this from the highest level, and if you can show that you're really doing anything, you will get funded. This is different from what I've both seen in the US and noticed and worked with in Europe. There is a completely different politics, and there's this great opportunity for us then to work together on solving things. The one thing I need to also mention that we just announced that we treated our first CAR-T patients with in-house manufactured cells, which is an achievement that when I was CEO of the Karolinska in Sweden, I was working with European healthcare leaders trying to do in-house CAR-T cells, so we would be not as reliant on the industry, and also we need to think about cost. We didn't manage to do that in Europe in my time that I'm there, but we managed to do that now in Saudi Arabia. We treated the first one in our phase 1 study of our own CAR-T. There's our own patent CAR-T cell, and for a patient that had been treated with other CAR-T cells treatments before, didn't have any hope of life. She's home now, cancer-free at the moment, and so we're very optimistic to that. So what does it do? It has impact on cost, because everybody in healthcare knows that this is one of the most costly things that we do. So we see that we save about 80% of the cost. So we are sort of going from 1.3 million SARS to about 250,000 SARS when we do it ourselves. It also impacts, for the patient, the production time. We've gone from 28 to 28 days, maybe 21 days if we're lucky, when this is commercially produced in another country by the industry. We've gone down to under 14 days. This is just the beginning. So I just want to say, this is an example of one of the more new treatments where we are on the right track. And this is not as easy as it sounds, because tried it, been there, done that in Europe. We failed, needed more time, needed more meetings, but we are in what we can say, we want to move ahead, we want to do things. Of course, we need to continue on our way in different things. We are embracing AI technology and doing that to help our patients. And there's a lot of AI technology that is out there, that is ready. But we need to sort of start trusting it, using it. So I just looking ahead, when we open the summit, we are reminded that healthcare is not a sort of a headache for one institution. It's the society. It's the biggest part of the society. You only need to see how much money we globally spend on this. This is something that we need to work on. There are so many challenges that we have. We have aging population. We have chronic diseases. We are treating things that were not treatable before, and that is a challenge. And the rapid pace of technology. I mentioned AI. So we need to embrace this. We need to work with this. There's a lot of things that are out there, but we have not managed to get it to our patients and to our healthcare workers, which is sort of a growing problem. There's a lot of things that can help our healthcare workers, not replacing them, but helping them to do more for the better of the patient. Ladies and gentlemen, it's with the spirit of collaboration and shared purpose, I officially welcome you to the C3 Davos of Healthcare New York Summit. Great to be here.
Thank you, and beautifully said. At this point, I'd like to ask Dr. Sam Laxall, who is our main sponsor, to come to the stage. And I would like to present him with Dr. Bjorn, the C3 Award for Healthcare Visionary and Pioneer Award. I don't think anybody better than Dr. Laxall could encompass this. So with that, Dr. Laxall.
Hi there.
How are you? Get your... Now you have to get this home safely.
I probably won't.
Thank you very much.
Well, thank you very much. And you heard doing... I get to hang out today with General Petraeus, who usually when I go to a healthcare conference, I'm a big deal. But no one looked at me. They all jumped over to General Petraeus. They said, "Can I have a picture with you?" So, we know hierarchy. But anyway, thank you very much. And you heard about what they're doing in the Middle East right now with advanced cell therapy. CAR Ts are a big deal, and they're doing it properly and beautifully at King Faisal Hospital. And to do that really shows that healthcare is moving forward in all parts of the world. So thank you.